morning, good afternoon, good evening. My name is Ian from Reformative. Today we're going to do a little bit of self-care. And we're going to talk about the ulnar nerve today. The ulnar nerve comes off the base of your neck at C8T1. It's going to go through your brachial plexus for the arm, go down the inside of your arm, pierce the elbow, come through the deeper side of your forearm here, and then innervate the outside, the pinky ring finger side of your hand. Usually the ulnar nerve doesn't really give people a lot of trouble. In fact, it's actually smaller the way it comes off of the group of nerves, the brachial plexus. But here and there, if you've been leaning on your elbows, or if you have a bit of tension in your elbow or in that part of your hand, more on the outside part of your hand, we have a few ulnar nerve tricks and neuromeningeal points for you. First thing you want to do, you want to be comfortable and you don't want distraction. Put on your favorite sweater and check the label. If it's acrylic, you want to return it, you want to donate it, or you want to throw it out. Buy yourself some cashmere. Make sure that you're comfortable in your environment and give yourself about maybe 5 to 10 minutes to go through these exercises. First, we're going to make the OK symbol, kind of about here in our chest. You want to think about your shoulder being supported and being connected to your back and strong in space. And you want to think about adding pressure or tension onto the nerve without jumping too far ahead. You are slowly reaching through space, moving that pinky kind of up towards your face until you feel that first bit of tension. And for me, that's kind of more close to my elbow, deep to my forearm. So I'm going to stay right there. And then just as carefully as I moved into that position, I'm then going to reach back out. And we're going to go back with that rotation 10 times. And ideally, you're just hanging out that first barrier, you're not pushing too far forward into that floss. And it's important to think of this more as a glide or a floss than a stretch. Nerves don't stretch, they're not into that. Nerves are in fact very smart and very responsive. With less, somehow it's more. So keep that in mind. So you've done that 10 times, you have a bit of release in that forearm part. Now we're going to add a bit more tension through this chain. So the next one, we're going to flex the elbow up, and then you're going to extend the wrist. And then just as carefully as you went into that, you're then going to release the forearm, and then you're going to go into that again. So elbow flexes back, fingers reach back, extending that wrist. And then doing that whole sequence about another 10 times. This next one is not a nerve glide. This is stolen from Tai Chi, but it's fantastic. Pushing the hand forward and then kind of pulling back. Keeping that elbow kind of steady in space as you push forward and then kind of whip that arm back. Doing that about 10 times or then more. And now let's get into your hand. So we're going to test between the third and fourth metacarpal of the hand, kind of where that ulnar nerve ends. And there should be, say, 1 or 2 points that are more noticeable than the rest. For me, it was definitely one right here. And now we're going to go between the fourth and fifth space of my hand. And then there's another one for me kind of in this space. So go back to the first one, test that. Go back to the other and engage that one. There should be one that's more noticeable to you. For me, that's this outside one here. Now, there's no medical disclaimer for this video. I would like you to embrace and use common sense. And if something hurts you, I would highly encourage you not to do it or to try it differently. A good way to kind of gauge this is to add tension until you feel like you're really kind of on that spot in your hand. It should feel direct. It should feel like that you're on something, but it should not hurt. Pain is not the clear message that you want to send to your brain. You want to challenge that spot and just hold there with kind of consistent pressure until that releases a bit. That might take up to 30 seconds to a minute or so. And once that happens, go back and then find that second point and then hang out there until you get a bit of release there as well. And then, once that happens, you can enjoy some of that space you then freed up through your arm. Thanks for joining me. Bye for now.